All right, so we are about 1 minute past currently. I just want to go through some quick Zoom etiquette for those that are on the call and those in the meeting room today. Before we call the meeting to order, I just want to introduce myself. My name is Ashley Anderson. I am the Public Information Officer for Southwest District Health, and I will be your Zoom moderator for today's session. Let's see. I will monitor and moderate Zoom activity. So note the following. Please be mindful of your conduct in today's meeting, as this is being recorded and will be made available for later viewing at the Southwest District Health YouTube channel. Currently, we are not accepting public comment during today's live meeting, so please refer to the meeting notice and agenda if you'd like information on that. We welcome email comments, questions, and feedback to publichealthidaho@phd3.idaho.gov at any time. And for those in the room, please direct any virtual or Zoom-related questions, comments, or concerns to the moderator or myself through private message at any time. I'd be happy to help you. And please remember that if you are not directly participating in the meeting or speaking at that time, please mute your microphone and or turn off your video if you have any sort of feed issues or bandwidth issues on today's call. And for those participating in the meeting room today, for the board members, please make sure you identify yourself prior to speaking and lean towards the microphone to pick up the audio as clear as possible. And I think with that, I can turn it over to Chairman Commissioner Elliott to call today's meeting to order. Thank you.
Okay, if I guess everybody can hear me. At least the little green light's on my microphone. So, oh, I didn't know you were here, Vicki. Good. Okay, so we'll call this meeting to order. To start with, we'll have the Pledge of Allegiance, and we have new people here today. So I will ask Commissioner Haynes from Washington County, would you please lead us in the Pledge of Allegiance? I pledge allegiance to the flag of the
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, thank you very much. We'll have roll call. We've got more people here than I thought we might today, but that's good. Vicki Purdy is present. Commissioner Haynes, as I mentioned, a new board member from Washington County. I have Kelly Aberstary. I'm Commissioner Elliott. We have Commissioner Georgia. I'm sorry, Hannigan, Commissioner Hannigan from Fayette County, and also Dr. Summers. We have Nate remote. Is there anyone else
here?
Oh, and Commissioner Smith, new commissioner also from Canyon County. So glad you could be here this morning. All right. I sort of already took some of the thunder, Nikki, but I'll let her do it properly to welcome our new incoming Board of Health members.
Actually, maybe this should have been yours instead of mine, but I did have the opportunity to meet Commissioner Haynes and Commissioner Smith last week and give them an orientation to the Board of Health, so hopefully they remembered some of all the information I'm sure that's being thrown at them right now in their new roles, but shared with them overview of the district, functions of the board, and shared the bylaws for the Board of Health and the Idaho Association of District Boards of Health as well. And so I want to welcome them. I don't think we have them approve all the ballots in yet from all of the other counties, so I don't think they're official yet today for the purposes of voting.
No, Jim County. Okay. Yeah. Haven't met yet.
Okay.
Anything else for that?
No, sir.
Okay. Well, welcome. We appreciate your your willingness to serve on a sometimes volatile board here lately. I mean, we're not so volatile, but some of the stuff is. Okay, has anybody looked at the agenda? Are there any additional items that need to be added or removed?
Chairman Elliott,
Yes.
I would like to propose, if possible, to add a legislative update under the director's report.
Okay, this is allowable as it's only informational. Anything else? Or objections to? Hearing none, I would stand for a motion. Okay, I have a motion, I have a second to accept the agenda as amended. No second? Oh, did you say? I didn't hear you. I'm sorry, Vicki. I'm getting old and my ears don't work that good. Okay, so we have a motion and a second. All in favor say aye. Aye. Opposed? Motion carries. Okay, thank you. Minutes from our December 15th, 2020 meeting. Are there any corrections, additions to those minutes?
Dr. Summers, on the open discussion, second paragraph, the last sentence says, at this time, board members do not support implementing a mask mandate. I think it should read, board members excluding Dr. Summers.
Okay.
Other than that, I would move their acceptance.
Okay.
Commissioner Hannigan, I second.
Okay, has that been changed? Will that be changed officially? She's got it? Okay. With that change then, I'll have a motion and a second. All in favor say aye. Aye. Thank you. Motion carries. Okay, we have an open discussion time here for a few minutes. Is there anything anyone would like to bring up that yes?
If someone is speaking, will you please press the button on your microphone in order to activate the microphone? We cannot hear you through the Zoom. I apologize. We still can't hear you on this side.
Oh, okay. Okay, so these are policies that are put in place. So, for instance, the schools, whoever's directing the schools, we're not telling them that they can't be in school, but the school boards are coming back saying that it's all coming from us. The pools, I read in the Argus, there's a pool that shut down in Payette, I believe. It's been completely shut down for a long time, and they're saying that the health board is responsible for that. I know that Zim Hot Springs is asking why they have to follow these guidelines, which I'd never even heard of before, on their pool limits on their numbers. So I guess I'd like some clarification on that. And then the other thing is, we are extremely, as Adams County and many other people have called me, dismayed that we would hire a lobbyist and spend $15,000 on a lobbyist, apparently so that we can have or keep control over the citizens regarding all of these policies. We are incredibly saddened that an action like that would be taken. As a public entity, and we should not be spending our money hiring a lobbyist, period. I just find that completely outrageous. So anyway, I just wanted you guys to know that. We did not vote on that as a board. It was done by the executive board, and I don't think that as the board should have been left out of that decision. I think we should have been able to make that decision and then send it to the executive board. And just the fact, maybe $15,000 doesn't sound like a lot of money to a lot of people, but considering the last year that everybody's been through and small businesses are still required to social distance and be at around 40 to 50% of their normal income because they can't go back to full operation. For us to spend $15,000 on a lobbyist so that we can apparently have more control or keep control or whatever control it is we have now that we're exercising over the people is just outrageous and unacceptable. Okay, that's it. Thanks.
Okay, thank you. Any other comments? Anything else that needs to be brought forward? Any discussion with what Commissioner Purdy has brought up? Any answers to what Commissioner Purdy has brought up?
Chairman Elliott, I can try to address some of those now, or, well, I could talk about the recommendations and the guidance that the district provides. The matters regarding the executive council, I could try to talk about right now, or we could wait till later in the agenda.
Okay.
When Commissioner
Dale
or Tom, I guess now he's not commissioner, but
yeah, okay.
plans to join the meeting. Do you have a preference?
Tom may have better answers. I don't know. If you feel that he might, let's go ahead and wait on that. I mean, I guess he was on the executive board when that decision was made, so probably he has, I would guess, maybe some better understanding of why. Personally, I have mixed feelings as to what Commissioner Purdy brought up. I'm not sure I agree with everything that she has said in that way, but I mean, I think you're looking at one area of control. I'm not sure of that. I'm taking it to mean that probably you're thinking more along the COVID lines and some of that, but if we're talking about septic systems, water purification, other things that protect a lot of the folks, I would publicly say that I do agree that we need to have some control, if you want to put it that way, over the folks from doing things that they shouldn't be doing that would affect other people very adversely, not only for right this minute, but maybe very, very long term. So, like I said, I got mixed feelings. I understand what you're saying, especially if it is relating to what's going on with the COVID right now, but there are a lot of other areas that this probably also affects, and again, that comes to, I just have a lot of mixed feelings when it comes to, like you, spending money that comes from the taxpayers, but at some point I think maybe some of those taxpayers would like to be protected from having their wells polluted or whatever, that is also part of it.
I don't think that's ever been a question, and I'm not questioning that, and the safety of water, septic tanks, so on and so forth. I mean, I'm not sure that we need this health board to do that anyway. As far as we would all want that as county commissioners, we would all want to make sure that building is done correctly, and we have different challenges in as the farther north you go with building. So I don't have that isn't the issue. No, the issue is we didn't need a lobbyist for that. So what are we hiring a lobbyist for? And I just find it unbelievable that we spend that kind of money. We just
Okay. Yes, it was there. Did I see another hand? Oh, okay. Back, Nikki.
Yeah, I'll go ahead and respond to the questions about orders mandating pool closures or something like that.
Okay.
To my knowledge, that, again, what I've said in numerous board meetings, we're providing recommendations and guidance. what businesses decide to do to protect their patrons or staff is not ultimately up to us to dictate to them. And if there are specific instances where you hear of that, I would like to know so that I can investigate that on our end to see what guidance was provided and that it's not being misconstrued as a mandate. So that's, I think, part of your question. I can also just briefly talk a little bit about having been involved in the Executive Council meetings, and I would like Commissioner Dale to have an opportunity to address the same question when he's up. But for example, right now there are several draft legislation bills that are being proposed that address everything from governance of the public health districts to powers and duties and violations. And we frankly don't really have the time and resources to be down at the legislature meeting with everybody right now. And our ask to the Executive Council was to have some support from a lobbyist who could help provide education and have conversations with our legislators around what we do as an organization or districts across the state, and that we're not just a COVID responder. We have a lot of other duties and responsibilities that we carry out every day that can be impacted by legislation that's maybe focused on a single issue. So that was, I think, more the nature of asking Mike Kane to serve as a lobbyist or advocate for the public health districts, and we have used him in past years in that capacity for other issues as well.
Okay. Yes, Commissioner Everstary.
The schools and that, and other entities, the reason
We're having difficulties hearing Commissioner Aberstary. If you can-
I'm getting there, okay. Anyway,
Perfect. Thank you.
Anyway, what I hear from the other entities, schools, other businesses and that is what they're afraid of is because they take dollars from the state and from the feds, that if they don't do exactly as what is recommended, that they could lose their funding or other things. Like we do know that some businesses actually got fined and stuff from the state. So I think that's kind of there's a scare or feeling out there that if they don't go by those guidelines exactly, they feel it's more like a mandate than just a recommendation. And I totally get that, because the state has already shown that they will fine businesses, and if schools don't follow, they have been told that they could lose their funding. So there's a scare there, and it's something that I think the legislators, I don't think that's our position, I think that's the legislators need to fix that.
Just one more question. A couple months ago, you guys had a meeting with the governor's office, Commissioner Elliott and Nikki, and the governor's office was threatening you. Would you elaborate on that one more time? What exactly did they want from that threat? Or
Well, that's longer than a week ago.
right?
At my age, my memory is somewhat cloudy back then.
Come on.
But yeah, Nikki was on the call with me, and they at that point basically it was not the governor, and I will definitely say it wasn't him personally. It was his folks on his committee, and I don't even remember the names of those folks at the present time. But yes, they were basically saying that they were very insistent that we pass a mask mandate, and if I did not do that as the chair, then I would be held responsible. They would make sure that everybody knew it was me. They would put that out. They didn't specifically say television and radio, but that was the inference, and so that anybody that got sick in our district, it would be my fault. And so there was I looked at it very much as an intimidation type of a communication. And again, I will say it was those folks that were on the committee. Where that directive came from, I do not know. Never went any farther than that. Never looked, never cared to. And so that's about all I can tell you.
That's all I need to know. I just wanted to clarify that because I couldn't remember exactly what it was that they wanted. But
No,
that
it was a
tactic
mask
seems to be
mandate.
going on everywhere. And it needs to stop. It's outrageous. Our rights are being attacked everywhere, from free speech to whether or not we should or shouldn't wear a mask or run our businesses. So I do want to say I appreciate this board's stance on all of those things for the people. We have done, I think, a fairly good job, and hopefully we continue to protect the rights of the people, because as elected officials, that is first and foremost the number one job of ours, is to protect the rights of the people.
Okay. All right, any other comments or anything else that you'd like to bring up in this open discussion time? If not, we still have a few minutes, but we got started really early on some of the other stuff. There it went fast.
Actually, can I add one thing?
Yes, ma'am. Go ahead.
Carrie Smith. Regarding the mandate versus guidance, I was formerly the CEO of Destination Caldwell prior to this role, and I just want you to know that when I made the phone calls to Nikki, we continued operating at Indian Creek Plaza for the entire year, and through COVID, we gained businesses in Caldwell. We did not lose them, and I want you to know that Nikki was incredible to work with. It was always guidance, not mandates. It was always working through health concerns and figuring out how to be in the best interest of the overall health of our community, which is still providing safe opportunities for people to gather. And I could not have done it without Nikki. And so I do want you to know that from my perspective, if people would take the time to make the calls and ask questions versus reading something and taking it as a mandate, what was coming out of Nikki and her team's mouths were absolutely helpful, and I would commend her and her team for that, and my community, I know, thanks her for that, because we're not suffering, and I don't think that our numbers are any different than those communities that are suffering because of mandates, and so I'm very grateful for the position that we were in, so thank you.
Very good, thank you. As Commissioner Abersturi brought up, we still have a few more minutes. If somebody would like to fill the time. It is open discussion. I mean, Dr. Summers, would you like to talk about fishing? Anyway, I know I'd rather do that than this, but okay. 10:30 is our COVID-19 situation update. It is informational. Is Jamie ready for that? Right behind me, man. We'll okay. We'll jump right to that then. If I don't have any other communications that wanted to be brought forth, then we'll turn time over to Jamie.
Good morning. Good morning, everyone. My name is Jamie Annenson. I'm a Division Administrator here at Southwest District Health, and I am continuing to serve as the Incident Commander for our COVID-19 response. So just wanted to give you a brief update of where we're at since our last meeting. In a previous meeting, I talked about our efforts to operationalize the response, and that is an ongoing effort. we're currently recruiting for a COVID-19 program manager, and we will be interviewing this week for that position. We're working closely with Eugene and High Focus to help meet the demands of the work and strategize for operationalizing our COVID-19 response. Currently, we have 20 Idaho National Guard members on site that are helping us manage investigations, testing demands, and the vaccination process. Our demands for testing have decreased, but we're consistently full each day, conducting between 15 and 25 tests per day. We've had a slight decline in cases with an average of approximately 75 cases per day over the last 2 weeks. And with great support of the Idaho National Guard partners, we no longer have any cases in our backlog, so we're really excited about this accomplishment. Our investigators are continuing to conduct more thorough case investigations, and we'll be utilizing the HealthAlert for our monitoring, and that's an online platform. Our long-term care facilities, businesses, schools, and correctional facilities are becoming more familiar with processes and procedures, so we're not having to provide as much technical assistance around investigations. We are getting more questions around vaccine-related inquiries. Currently, we have no confirmation of any COVID-19 variant strain in our district. The state lab is conducting random testing for the variant with our samples, and we have plans in place to conduct extensive contact tracing efforts should we detect any of these variants in our district. Healthcare partners are seeing a slight decrease with COVID-19 patients and hospital surges, but are remaining close to capacity day in and day out with beds and staffing. And our partners are helping with the effort to vaccinate our communities. The demand for vaccine remains extremely high. We're averaging 300 to 400 phone calls per day. We're receiving hundreds of voicemails and text messages. This week we're standing up our call center again to handle the volume of inquiries related to the vaccine. And on January 20th, we initiated an online vaccine form. We're averaging over 200 emails a day because of that form. So individuals can go to our website, sign up for future information about vaccine availability. We have a vaccine interest list. We have over 1,200 people on this list who have reached out to us looking for information, with about 85% of them being 65 and older. So we're continually working on communications and educating the public. And Sam Kenny, who is with me in the room today, she's serving as our partner relations specialist. She's working with Dave Hanneman, who's doing extensive planning for our effort. They've been working diligently to develop a vaccine distribution plan and to enroll additional vaccine providers. So to date, we have the ability to do up to 20,000 vaccine doses a week. However, our allocation continues to be significantly lower. So we've been collaborating with our enrolled vaccine providers, or partners, and providing regular situational updates. So we've been able to provide messaging and a plan so they're able to address the needs in their community and set up clinics in advance. So we're preparing for starting to vaccinate 65 and older on February 1st. That is all I have for an update. Are there any questions?
Dr. Summers, has this organization or any of the other vaccination organizations looked at doing any outreach to communities that don't have access to health care?
I'm going to defer to Sam to talk about from a provider relations perspective. Hi, Dr. Summers. So your question was, are we doing outreach to certain populations that have trouble accessing health care? And I will say yes, we have liaisons for certain populations and also certain groups, priority groups that have been working with those groups to connect them to partners. We are creating a strike team with some of our National Guard here to go out to some of those rural areas and help. And I think we have partnered really well with our rural communities and distributing our vaccine across the footprint in a way that those seniors especially to travel as far to access their health care. They can access vaccines in their pharmacies and in their primary care practices and in the rural hospitals and rural clinics across our footprint.
I would assume that the outreach would be with the Moderna vaccine.
Yes. I mean, we're getting, we've been getting more Moderna than we've been getting Pfizer. And Pfizer, we tend to get to the bigger systems, St. Luke's and St. Al's, because they have more capability with it.
Right. Okay.
Anything else? I just had a question. I know we've talked about this a lot in our with our emergency manager person in our county, and then we also had a meeting, again, phone or Zoom, with the governor here just last week, I guess it was. Yeah, Thursday. And I still have questions as to the amount of vaccine that we're supposed to receive. And I mean, you're talking about what do you say? How many folks a day that you're testing? And you're full. What is that in the actual numbers of people that would like to be tested but can't be tested? Any idea on that?
So if I understand your question correctly, right now we're testing 15 to 25 people per day. We're testing them, and we have been able to handle all the interest. So we're not necessarily full on testing. However, vaccine interest is a different story. Our current allocation is 3,000 doses approximately a week. And as I mentioned, for our district.
Okay.
We're hopeful that there will be a slight increase in that next week. Numbers we're hearing are about 10%. So still, if we're getting 300 to 400 calls a day, and we have an interest list of 1,200 people, we're not able to meet that demand.
I mean, I know you can't get more. I mean, it has to be given, but what are the actual numbers of folks that we think might want to be vaccinated in our district, and what is that? How many weeks does that come out to at 3,000 a week? I mean, is this going to happen before this time next year, that all those folks are able to be vaccinated? And I know we don't have control over the number we get, but I think this is something that needs to be looked at and pushed to the governor, and the governor needs to push it back to, on up the chain somehow. Anyway, I just don't see this getting much better for a long period of time. Yes, the doctor.
If you take the state population of 1.8 million, and we're getting 20,000 units a week, that's 90 weeks.
Okay, so almost 2 years. Yeah, okay. Yeah, and in 2 years it will probably be a different variant. That's just kind of the way viruses go. At least most of the corona. And I know not everyone will take the vaccine. That I'm sure of. My wife is one of them. But anyway, and I guess the other question, semi-related, it's not really along the vaccination line, so maybe I ought to bring it up later, but is the actual number of folks who probably have had the coronavirus, this one, the COVID, and because I mean, I personally know a lot of people who are very sure that they've had the virus and never went and got tested for several reasons. One I know right now is that a lot of the insurance company actuaries are, at least by their statement, I don't know this is absolutely true, but by their statement is that if you're tested, I mean, it's on your record forever, and if you have it, you might, I mean, they drop you down, they raise your rates, they might not even cover you in the future because they don't know really all the long-term effects of what this might do. I mean, so in some way, I mean, I understand what they're doing, but I know a lot of people right now that will not go and get tested for that very reason. So, I mean, I just have a concern as to what the real number is of folks that really probably have already had it, and then what does that do? I mean, where are we at in the herd immunity process? And, you know, I mean, it's something I don't think we can answer, but it's a concern that I have.
I think that's a good concern too, because I've heard from private schools that have ran the herd immunity theory, and it ran through their schools, and they have no ongoing issues.
They just don't have it.
And they're doing well, and the children are thriving, and
anyway, it's questions I don't think we can answer here, but it's something I just want to throw out that it is a concern of mine as to what we as a health district are focusing on, and government also, the way that some of this is being handled. I mean, where are we at? And that's a question that I would like to see answered, and that might make a lot of difference in what we do. Anyway, I'm spouting off.
do you want Sam to maybe address the vaccine?
Yes, please.
So, focusing on our senior population, 65 and older, we know that there's over 46,000 seniors in our area. Guessing by the number of calls and the interest that I'm hearing from all of our partners across our footprint, there's a high percentage that want the vaccine. And so in our planning processes, with 3,000 a week, we're estimating it would take us about 6 to 8 weeks to complete.
How long?
6 to 8 weeks to complete our senior population.
If
the
all the
allocation-
vaccine was dedicated that way.
No, if we continue at the rate we have, 3,000 a week.
I can't get that math. 6, 8 weeks maybe at how many a week?
3,000 a week and
That's only 24,000.
and increasing at 10%. Anywhere from 3 to 10% a week is what we've been told by the state that we will be increasing that.
Okay, 10% makes it 3,300 times 8. You're still less than 30,000. So the math doesn't come to me exactly.
No, we're not expecting 100%.
Okay. Okay, so that's basically a little less than 2/3.
That's about what we're expecting.
Okay.
Yep.
Okay.
You're just referring to our health district, right?
Yes, exactly. Just our health district and our footprint. Yeah, and we have it broken out by counties and trying to distribute according to the population in those counties so that we don't forget our Adams County and our White County seniors. So, in that planning.
Good. Well, that's shorter time than I would have thought for that age group anyway. So that's good. Probably the more vulnerable age group, at least it seems to be by what's been going on. Kelly, what? Kelly? By far, yeah. Okay. Yeah, go ahead. Okay, we had 5 minutes. We'll throw it back in there. Go ahead.
Can you hear me? Can you hear me now?
Yes.
Okay, I know that we have COVID. We've had it for here in the United States for just under a year now. I think we've had it here longer than that. I think with actually in October, they kind of think that maybe now in October or November it was here. But anyway, I have these questions to the health district. I sit on this board, and for the last almost year, all we've done is done is COVID. So I want to know how the clinics are doing. What are we doing? How is WIC doing? How many septic systems are we doing per month? That's what we're supposed to be doing. What are we doing? I mean, we spend all this time on COVID, and I'm sorry, we're still at only 1%. 1%. We're giving up everything for 1%. So our job is not just COVID. So I think and I know we're doing that, but I never hear anything of that. How and when Carol comes on, I want to ask her how many people are on WIC now. Have we had a big increase on WIC because of the economy? Our economy is good here in this state, but there's still certain things that are going on that maybe those people need WIC. Those are the kind of things I want to hear also, not just spending 3 hours on COVID. Thank you.
May I respond? Thank you. Thank you, Commissioner Abasteri, for your question. And although we don't have it on our agenda today, we have been providing clinic updates. Yeah, a lot of it's been around just our transition based on the direction of the board. And certainly we can do more about that. And we certainly have brought things to the board that have been, I don't want to say fires, but higher profile challenges that we've had to deal with over the last year, some of our water quality and septic system challenges. So I appreciate that feedback, though, and we can certainly work on putting more of those updates into the board agenda. And I'll also just mention last year we had started our strategic planning review and process around March, and that got delayed because we had to shift staff resources at that point over to the response. But as you know, we've been working on shifting them back into regular duties. We also had some staff turnover, so Christina Freud had been working on leading that, and as you know, she's no longer here. But Sam, who is just sitting here, has filled that role and will be helping us through that process. So we'll definitely be engaging the board in that work as we move forward, and are working hard to get our staff resources back into their day-to-day jobs and making sure there's attention on that. I can assure you, all things are being managed and taken care of at this point, and certainly we can highlight that at the board, so there's more to hear.
I do know that everything is going on, but I don't think the general public knows that we're doing all that. That's why I bring this up, because all we talk about in here is COVID. We don't talk about all the other things that we are responsible for doing. And I think that is very important that the public knows that we're not just dealing with the coronavirus, that we're dealing with septic systems. We're dealing with, I mean, I've met more with Mitch in the last couple of weeks than I have all year because of other issues, So, solid waste, that's another big thing. Every county has it. Every county. So those are all things that I kind of miss that we don't talk about anymore, and I would like to see those things. I mean, I love when Carol comes in and says that our WIC numbers are down, because that means that things are going well. When Carol comes in and says that our WIC numbers are way up, then I have concerns, because my county is probably the poorest county in the state, as on average for poverty. I think it used to be Canyon County, but I do believe we've surpassed that now. So anyway, just those kind of things are very dear to my heart. So I would appreciate if we could get those back on the more involved, because as Commissioner Elliott knows that he has septic septic issues in his county, and so do we in our county. So we have a lot of other things we need to discuss. And I thank you very much, Nikki. I know that you're doing all those things. I do know that, but I don't think the general public is realizing how much other stuff we do. Thank you.
Thank you, Commissioner Abasteri. That's a really good point. I know we didn't quite have the audience that we do now at our Board of Health meetings as we did, prior to COVID. So we'll definitely work on getting that into the agenda as time allows. Thank you for that input.
Okay, thank you. Yeah, you took 7, but that's okay. No, I agree. That was, I agree very much that the public might not think we're doing much other than COVID, and we are still doing all the things that's been asked of us to do with COVID, plus all the stuff that we have been doing in the past. And it's just, it has been, I think, very overwhelming for the staff here, and I appreciate the level of attention that they've given to make sure that those things are taken care of to the best of their ability. Okay, next on our agenda is our COVID-19 Health Alert Level update. So is that you, Nikki, or Rachel?
Commissioner Ellie, I know Rachel will be providing the update, but before she starts, one thing that just actually speaking of what Commissioner Abastray was just commenting on, this is listed as an action item. If you'll recall, the board asked more than several months ago, it feels like, to have a monthly review of just our methodology and how we're applying the health alert levels, and then approve that every month. And I would like to ask that the board maybe consider, I don't know that we need to have it as an action item at this point moving forward. The methodology's been pretty solid. If we were to change it now when we've been using it for so long, I don't know how much benefit that would be, but certainly I feel like any action item related to COVID seems to draw attention, and I just am going to ask that maybe you consider that or discuss it as you think about after Rachel gives her update on where we are with our health alert level update. So Rachel, I'll pass it on to you.
Hello, can everyone hear me all right?
Yes.
Okay, great. So hi everyone, welcome to our new board members. My name is Rachel, and I'm going to be delivering monthly updates for the Health Alert Level system. So just a review for those of you who don't know, we use 13 different metrics, and we look at the previous 2 weeks worth of data. Each week we do this on Tuesdays, and then we publish this information on Wednesdays. And we have a 4-level system, so red, orange, yellow, or gray. We haven't had our meeting yet this week. We'll have it this afternoon, but I will go over some of the data that we use to make these decisions. So overall, we've seen a decline in COVID incidents comparing this week to last week. Over the past few weeks or months, we have seen an increase in cases likely due to traveling or gathering for the holidays. We're finally kind of outside of that window for holiday gatherings, but we are still seeing quite a few travel-related cases. So when we look at the COVID-19 incidents between this week and last, we actually saw a 20% decrease district-wide. So that went, yeah.
Sorry, we're having a little bit of hard time hearing you. It's kind of breaking up a little bit. I don't know if that's happening on the other folks too, but.
So it just keeps happening. It may be a bandwidth issue. Rachel, if you keep cutting in and out, maybe turning off your video would reduce the bandwidth if there's an issue with
Sure.
that. Mm-hmm.
I can do that. Okay. Is that better? Can you hear me better now?
Yes.
Okay, great. So where did I lose you at? I can start from the top if you'd like.
Yeah, about there.
Okay.
About at the top.
Sure. So I was just reviewing the Health Alert Level system for our newer board members. So we use 13 different metrics, and we look at these each week on Tuesdays, and then we publish the data on and our decisions on Wednesdays. So we look at these 13 metrics for the previous 2 weeks and decide a level, either red, orange, yellow, or gray, that corresponds to the risk to the community. So over the past week, as compared to the previous week, we have seen about a 20% decrease in COVID-19 incidents district-wide, from about 5.8 daily cases per 10,000 people to about 4.6 daily cases per 10,000 people. This is really promising, and we're hoping to see this decrease as we get the vaccine rolled out, especially to those frontline workers and our healthcare workers and things like that. Hopefully we'll continue to see this decrease happening. I also touched on, we were seeing quite a spike over the past few weeks prior to this week. And we were likely seeing a lot of that was due to gathering for the holidays and traveling for the holidays. And we are finally outside of that window for holiday gathering exposure. So that's also a good thing. But we are still seeing quite a bit of travel-related cases, people traveling to different states or nearby states, which is especially concerning right now with the new variants being found in other states nearby. So, and then there was one other thing I wanted to touch on. I do have a request for the board that was prompted by a public comment that's regarding our health alert level mitigation strategies. So I'm going to share my screen. So these are our mitigation strategies. This can be found on our website here on the COVID-19 Health Alert Level Advisory System tab. It's the second visual here. And some of our board members will remember we made edits to this about in late 2020. Originally, we had each of these bullet points and then or for each of the bullet points. And we request through each of these just to imply that we do intend, or we recommend that each of these mitigation strategies are used in combination. And we had a public comment that highlighted the fact that it still isn't exactly clear, and that maybe by adding the word "and" after each of these bullet points that we can show, you know, we intend for all of these mitigation strategies to be combined and used as one. So I'll leave that up to our board members to vote on that. And I'm open for any questions if you have questions for me.
Questions? Comments?
I just would like to add, I know that one of the concerns with this health alert levels goes back to what Commissioner Purdy was, I believe, alluding to, is that people are really relying heavily on these levels and not opening because of them. And I would like more information on the 13 levels, or the 13 data points that they're using to establish these. And these are really important to schools opening and sports happening. And I think that one of the concerns is that only some people use these levels versus others. And so there's a lot of inconsistency, and it's hard to understand why you can have so many people in a store versus in a gym watching their kids. So I think that these levels are really important, and we as a board should be really cognizant of what they mean and what that means to our constituents.
Okay. Anything else on that? Yes, Doctor.
This is Summers, and a question is, are all the other health districts using exactly the same
Metrics?
Don't think so.
Okay.
Yeah, this is Nikki, Chairman.
Yes, go ahead, Nikki.
Thank you. Dr. Summers, no. So early on when we were trying to, I think, communicate to the public on what the risk was for community spread and exposure in public settings, we worked with our peers across the districts, and I'd say our measures are very similar, but they're not all exactly the same. But if you were to put them up next to one another, you'd likely kind of land in the same place. Your metric might just be a little bit different. And we do have those 13 measures. I think if you scroll down on your tablet, Carrie, that keep going. Nobody else can see this, but I think, yeah, there you go. So you can see we do have a dashboard on our website that shows each of the metrics and defines them, and those were vetted through the board as well, and I should say vetted through the board, but developed by our internal staff with input and guidance from different resources across the state and country. So we feel pretty confident as you can be with a new disease in a new kind of pandemic. I guess none of us done this before, but we're giving it our best shot. So that is why we had the board, I think, had wanted it to continue to review it monthly to provide input on that. And if there's something that you would like us to do differently or more information you'd like us to bring back, we're certainly open to that.
Okay.
Can I comment?
Anything else?
Yeah,
Yes, go ahead.
we all work pretty hard on our emergency plans in our counties, and this is from the Idaho Emergency Operation Plan. So if we were even in a moderate pandemic, the attack rate would be 25%, and this was updated in 2019 with a 1.5% fatality rate, 432,680 illnesses, and 6,490 deaths. After 1 year, we are not even in the moderate range of the attack rate. Positive case ratio would be 22.1%. The fatality rate is 1.03%, and that's not even factoring out all the deaths that probably weren't from COVID, but they listed COVID on the death certificate. The illnesses are far short of what the moderate pandemic would be if we were actually in a moderate pandemic. So maybe we're just calling this a light pandemic, considering the numbers and considering our Idaho State Emergency Plan. So I would say that maybe our rating system is far too extensive and punishes our kids and our parents and our businesses.
Okay, thank you. Any other thoughts, comments? Okay. Yes, Nikki, go ahead.
Well, I'm trying to, I guess, listen to the comments around the table and decide what to do with that with the information. It's a little bit, thinking about the kind of bigger picture outside of the district and where the governor stands with orders, and trying to, balance, where we feel we are as a district and also where the state is. So, again, I guess if you, and I would say our partners, right? So we talked a little bit about like pressures on the healthcare system. But I don't know that I hear ask in there unless you'd like us to come back and kind of go through the details of the measures and provide input on something different, I guess. I'm not sure. It's a little bit challenging for us to, I think, we could reassess it and come back maybe with a different presentation to have you react to.
Yes, go ahead.
Thank you. Commissioner Purdy, are you asking for this dashboard to align closer to what you're looking at? Because I don't know what you're looking at, but is that what you were asking?
Yeah, I'm looking at the Idaho State Emergency Operations Plan that apparently isn't being used at all. So, yeah, I would request that we reassess all of the guidelines that we've been using, maybe to more align with this. And we might find out we're not in a pandemic. We do have definitely a very bad virus, but and the other thing, it might be prudent to ask how many flu cases there are. I believe there's only like 900 in the entire country.
Sorry, I didn't catch the last
Well, I guess the point I've made this before is that everything's COVID, and the guidelines now for the PCR tests have come out and said that from the WHO and CDC that if you don't have any symptoms but you test positive, you may not have it, retest. You may have such low levels that they aren't that you couldn't possibly pass them if you were asymptomatic. It just seems like everything, the ball keeps, being thrown up in the air and changing constantly. So yeah, I would request that we reassess these guidelines as to what's actually happening with our current information.
Okay. Any comments or discussion on that request? Yes, go ahead, Doctor.
I guess you need to pass that around so we can all look at it and copy to everybody so we can look at it and maybe in a month tear it apart.
Okay.
No, there's front and back, 2 pages.
I don't know that I support tearing apart a adopted state emergency operations
Well,
plan.
that was
That's what that is.
I know that, I'm just saying I don't support
but I
tearing
think
apart that
I
plan.
think we need to look at it, and if it's applicable, great. If it isn't, then let's change it.
And they did just update that in 2019. That is the latest update.
So,
Yeah, I don't have one either. It's okay. It's all right. There'll be more. They're just like potato chips. They'll make more.
I just know from experience, I sat on one of the emergency boards for the state of Idaho, and they do not take these plans lightly. There's a lot of effort that's put into them, and so,
Yeah, I think you're going the opposite way from what Commissioner Purdy was saying. She was saying basically, I think, maybe I'm putting words in her mouth, but this is what I thought I understood, is she would like the Southwest Health District to follow closer to those guidelines rather than flip-flop.
right.
Okay. And you were saying tear it apart.
No,
so-
no, he did. I said I don't.
Oh.
Look at it and take it apart paragraph by paragraph.
Oh, okay,
And
okay.
understand what it says.
All right, I got that part of it. Okay. I misunderstood your direction. Okay, anything else on that? If not, yes, Kelly? Okay,
Are we waiting a month to look at the dashboard?
probably, well, yeah, I think that needs, if we're going to do that, that needs to be brought back on our next meeting. Is that something that the board would like to do? We can't do this, well, is it an action item? I guess it is an action item. So if that is something the board would like to do, I would stand for a motion to, yes, go ahead, Commissioner.
I would just like to say I'm not comfortable making any drastic changes today.
Right, no, I'm definitely not equipped to know even what it says.
Yeah.
And then make some comparisons to the system that we are using right now. So if that is something that we'd like to look at next meeting, even though it's more COVID stuff, Kelly, I think it maybe is a good idea for. I know. But if that is something that the board would like to take a look at next meeting, I would stand for a motion.
Yes, I would make that motion that we reevaluate.
Okay, I have a motion. Do I have a second?
Can I vote?
I have a motion and a second. All in favor of bringing this back for a new look at our next meeting, next scheduled meeting. Not a special meeting, but in our next scheduled meeting. Aye?
Aye.
Okay, are there any opposed? Okay, otherwise motion carries unanimously. Thank you. Okay, we will put that in the rear view mirror. Is there anything else that we need on that update, Nikki?
Mr. Chairman? No, I do not believe so. Thank you.
If that's the case, then let's go into the introduction of new employees from the division administrators. Okay, I can. Yes, go ahead, Doctor.
With the mitigation stuff, there was a question about adding and. Were we not going to do that, or are we going to put that off?
I would say let's wait until we look at this other, because that might change.
Okay.
And at that point, at that time, that can be brought up. I would think that for 1 month it may not be worth it, and I would like to know, even looking at that, exactly what that does if you add and after every one of those, what that does as far as becoming more of a mandate than it is do this or this or this, not every one of them. And if you don't do every one of them, you're not doing anything. That is my concern. Anyway, I think that can be brought up when we go through that next time. Okay. I hope. With that, new employees.
Maybe Carol?
Thank you, Kelly.
If anyone is speaking in the community room, we cannot hear you.
Okay, can you hear me, Ashley?
Yes, just make sure that you're close to the mic and you identify yourself when you start speaking. Thank you, Carol.
Okay, Carol Julius, Clinic Services Division Administrator, and I have 4 part-time staff, 2 full-time staff, and 1 volunteer that's helping us with our new venture in Marsing School District. So, is it okay for them to say a few words about themselves? Do you have enough time? 7 people.
Yeah, probably.
Okay, so I have 2 peer counselors with the WIC breastfeeding program, Emily and Melissa.
Hi, I'm Melissa. I have 2 little boys, which made me want to be the breastfeeding peer counselor. I just love to help new moms, and it's just something I'm super passionate about. So I'm definitely grateful and thankful that I have this job so I can help.
Very good. Thanks.
I'm Emily Hayes, and I grew up in this area. I love the Treasure Valley. I have a 3-year-old boy and a 1-year-old little girl, and I'm really excited for this opportunity to, like Melissa, help new moms have the education and support that they need to successfully raise.
Very good. Thank you.
Okay, the next 2 are with our home visiting program, parents as teachers, and their resource navigators. We have Janae and Michelle.
Hello, everyone. My name is Janae Sanchez, and I was hired on as a parent educator. I am a licensed social worker. I was working in child protection with the department prior to coming here, and have my bachelor's degree. I'm very excited to be part of this home visiting program. Mostly due because it's just a phenomenal program to go in these homes, and it's kind of a preventative measure of helping these parents really be empowered to work with their children and, look at different developmental concerns that their kids might have at the time and teach them so that we can maybe turn around some of this children in care and a lot of the issues that we have going on in Idaho. And so I was just ecstatic to be hired, and I'm excited to get started. Thank you.
Good. Yep. Very important.
Hi everyone, my name is Michelle Worth. I come to you from Idaho Job Corps, before that juvenile corrections. But I started my career as a tutor in kindergarten. So along the way I got my bachelor's in psychology. So I've had to kind of shift focus and go back to the littles again with a little bit of preventative maintenance. So I'm just happy to be here. Thank you.
Okay, and my next two are our nurse practitioners, both working part-time, and I have Chris Eastman and Jamie Jenkins.
Hi, I'm Chris. I graduated from Northwest Nazarene University in August with my nurse practitioner degree, and I've been working as a nurse prior to that for 20 plus years at St. Al's, and currently also help over at St. Al's as a lactation consultant there too. So I'm really excited to be here and have the opportunity to help build the clinic here at Southwest District Health. I'm Jamie Jenkins. I'm a family nurse practitioner. I came here recently from Seattle. I've been working in family practice for past 16 years. I'm new because I'm new to Idaho. I'm also new to public health, so this will be a little bit of a learning for me, but I'm excited to bring my primary care experience and work on building the clinic here.
One more, and I have Max Beltman. He is nurse practitioner with Boise State University. Excuse me, and helps us with our Marsing School District venture.
Hello, everyone. My name is Max Beltman. I've been teaching pediatric nursing at Boise State for 15 years now, and up until a couple years ago, I worked a lot with child protection services in Kane County Region 3. Now I'm happy to be going out to Marsing every Monday, working with one of the nurses, Francis, here, providing any and all health services to the community on the Marsing School District. I just finished my third week yesterday.
Hi everyone, I'm Jamie Annenson, Environmental and Community Health Division Administrator. Really tall, so I was just trying to make adjustments. I have 5 staff to introduce today, and I'll start with Savannah Rodriguez. Savannah is on day 2. She is one of our new environmental health specialists. She'll be focused in our consumer protection program, so working on food establishments and child care facilities.
Hi everyone, I'm Savannah Rodriguez. I'm a native Idahoan. I graduated from the University of Idaho back in 2019, and I'm super excited to get started.
Ricky, I'm going to have Ricky come up and introduce his staff. So Ricky Bowman, Program Manager.
Oh, yeah, you can bring it down a bit lower. All right, so I don't have the same problem as Jamie, which is okay. Good morning, everyone. So Ricky Bowman here, Public Health Preparedness Program Manager and Epidemiology Program Manager. So we have 4 staff that joined us within the last meeting that you guys have had. So first we'll start off with Lakshmi Rita Venugopal. You want to come up? Lakshmi is our new infection preventionist epidemiologist. So she's going to be working closely with our healthcare partners and with our business and school districts on infection control strategies.
Hi everyone, I'm Lakshmi. So I joined yesterday, and I'm originally from India. I'm a physician, licensed physician there, and did my master's in public health from UC Berkeley. I'm excited to be part of the COVID response team at Southwest District. Thank you.
And then next we have 3 COVID investigators that are working on our schools team. We'll start with Janine Crockett. So these 3 are working on our school team, and they've been doing a great job. So, Janine?
Hi, my name is Janine Crockett. I am a native Idahoan. I just graduated with a Bachelor's of Science in Public Health from BYU, Idaho, and I've been here for about a month, and I'm loving it so far. and I'm happy to be here.
We'll move on to Raymond Hall. One thing I have to mention about Raymond is that when he was deployed with Idaho National Guard, he was assigned to the school COVID investigation team, and so when he came off deployment, there was just a perfect opportunity to bring him right back in. So we're glad to have him.
Morning, Raymond Hall here, Schools Investigation Team. So like you mentioned, I was originally with the National Guard, working with the Schools Investigation Team, which led me to the opportunity to come here as a civilian and continue the same work. So just want to say I'm very excited for this opportunity to be able to continue with the mission and help make a difference with what's going on with COVID. Thank you.
And the last one, we have Elizabeth Saladicki.
Hi, I'm Liz. I'm a COVID investigator with the schools team, originally from North Carolina, where I got my master's in social work, and my background is in behavioral health care and public health, so I'm really excited to kind of join those two experiences and support the communities here in Idaho with the COVID team. Thank you.
And Doug, which I'm not sure if Doug's here in person or remote. All right.
Good morning, everyone.
Thank you,
Can you hear me?
And
Yes,
Doug, do you have anybody to introduce?
I sure do. Can you hear me?
Yes.
Very well.
Okay. Well, this is what you get, unfortunately. I'm going to yell. We have three new staff. We have 3 new staff in general support. We have Christina Straub, Andrew Aridia, and Kristen Foss. I'm going to have them introduce themselves, okay?
Hi, I'm Christina Straub. I graduated from Humboldt State University with a Bachelor in Sociology back in 2006. I have a 4-year-old daughter. I had previously worked for Department of Health and Welfare and Idaho State Police, and I'm really excited to be here. Thank you.
Just a
Good morning,
moment.
everyone. My name is, I'm sorry.
Sorry. Just confirming with the room, can you hear the audio coming from Doug?
We can on the speaker up front, but not on the one back here.
Okay, great. Thank you. Doug, any of your members, please make sure that you speak up into the microphone. Thank you.
Good morning, everyone. My name is Andrew Heredia. I'm a Human Resources Associate here at Southwest District Health. Prior to working here, I was in the United States Marine Corps for 4 years. Currently, I'm finishing up a management degree at Arizona State University. I'm pretty big on public service, so I'm really excited to be here. Thank you.
Hi, everyone. My name is Kristen Foss. I'm from California, where I earned a bachelor's in public administration. I'm working here as a Human Resources Associate. I have a background in human resources and finance, so I think I can bring a lot here, and I look forward to it. Thank you.
Very good. Thank you.
Okay, that's all the introductions we have in general support. Thank you.
Okay, thank you. Okay. Is that all, Nikki, on that? Okay. So we have quite a few new folks here this month. I guess we will now go to our agenda of expenditure and revenue report from Troy.
Good morning, everyone. Can you all hear me okay?
Yes, you sound great.
Okay, great. And I really wish I was in this lovely location behind me, but I'm really not. Good morning, everyone. For those new faces in the room, my name is Troy Cunningham. I'm the financial manager here at Southwest District Health. And kind of my purpose here today is to provide you with a kind of your finger on the pulse of how we as a district are doing financially, not just in our cash presentation, what we have in revenues and what we have in expenditures, but kind of give you a tool to look at how we can forecast what we're going to do for the rest of the year and how we may need to adjust budgets and do those kind of things as we go along the way. So I'll have some more information about that as we go along, but I'd like to just kind of touch bases on a document in front of you. You can see that from your packet, there's a budget report for December of fiscal year 21. And at this point, if you look up in the upper right-hand corner, you can see our target for this time of the year should be 50%. So we're halfway through the fiscal year as of December 31st. And you can see in that first column right underneath that target is what happened this month. So in the month of December, you can see that our net revenue was $856,764. Our net expenditures were $940,932. which gives us a net cash position of a negative $84,168, which isn't terrible, and actually that's not a bad place to be in. If you look just to the column right next to it, you can see our year-to-date cash position. You can see that our net revenues as of December 31st were $6,121,000, and our expenditures were at $5.42, leaving a positive net cash position of $700,000 roughly. So just for the new folks in the room, we did have an occasion. So as an example, when we look at how fiscal years kind of touch each other, when we have billings that happen in one fiscal year, they kind of sometimes that revenue can land in the current fiscal year. So that's exactly what happened this year. We had a lot of COVID costs that we were working through trying to find homes for in our funding streams. And so what happened is a lot of those were billed like in that last few weeks of June and in some in July. And those revenues actually landed into fiscal year 21, but the activities themselves occurred in fiscal year 20. So that is a little bit abnormal for us. And if you remember from our fiscal year 20 report, the end of the year report showed that we had an actual negative cash impact. So that was where those costs that we had in COVID that weren't being reimbursed didn't show up in fiscal year 20. So they actually landed in fiscal year 21. So that's why we actually have kind of this surplus and cash position. It's not really technically a full, why did my head keeps getting cut off? A full net cash positive position. So just kind of take that into account. But when we look at our current period, which is the December period, that negative $84,168 isn't really terrible. We still have some COVID billings that we're working on getting done through the CARES Act. So some of that is still being worked on. So we do have some expenditures that haven't been reimbursed, and it's a lot more than $84,000. So once that actually happens, the fiscal year itself should settle itself back down. As we start getting these funding streams, and I have a slide in my next presentation on the agenda, will be to talk about some of our new funding opportunities and grant activities that we've had opportunities from this fiscal year that we didn't have it built into the fiscal year 21 budget. Obviously, in March of 2020, we weren't aware of really kind of the scope of how COVID would touch our budget. So I'll be presenting those to you later. So if you look then just a little bit down from where we were just at, you can see then our total budget, you can see our direct budget, our total budget, and then our year-to-date column is right next to the column of the direct budget. You can see, again, those numbers tie to our total revenues. So this top piece is the revenues, and you can see in our year-to-date totals for each of those. So if you base that number on our direct budget, so for those new folks, this direct budget is those costs that are not associated with our overhead. Essentially, these are costs that we budgeted outside of overhead. So when you look at our current year-to-date in revenue, say as an example for fees, our budget in this environment was $1.5 million essentially, and we are currently at $726,000. So that gives us a percent of revenue. So in fees as a district, we're about 2% shy where we should be with regards to fees. And that is in comparison, not just to what we think where we should be, but to the actual budget itself, where we thought we would live, or when we created this budget outside of what COVID would have impacted us with. The largest number that you can see is that line right below, which is 77%, and that is really the bulk of that is our COVID revenues. So those, up until the CARES funding, all of our revenue reimbursements have come from contractual reimbursements. So those are subgrants that we have primarily with the Department of Health and Welfare that reimburses us for those activities. You can see, obviously, we haven't had anything happening in sales of assets. Our interest, we're at 15,000, and there's a yield table on this, and you can kind of see initially we based that budget of 80,000 or 69,910 based on where kind of the pattern that we had the prior year. Well, obviously, due to the economy and the interest rates, those yields have definitely plummeted, and so we've had kind of lower yields than we anticipated in revenues and interest, and you'll see that in the table on some of the other sheets. And then the district funds are essentially those funds that are needed to fulfill the remaining obligations to kind of fill the gap for things that we don't get reimbursed for. So that's not really a number that we watch because it just kind of ties into what is needed in the budget. Those aren't true revenues. And so when you look at the expenditures down below, this is where these are the costs that are associated. So this is really at least from my standpoint, really the most interesting. This is where this gets a little dicey, and I want to make sure that we kind of wrap our head around it. So like as an example, in personnel, our target should be 50%, and we're at 63%. So we're 13% higher than we should be at the halfway mark. And really the primary reason for this is the increase in staff that we've hired for the COVID response. We've hired kind of a little army of folks to kind of deal with this. And so that is where the bulk of that increase in personnel comes from. However, there is also this dynamic, and I think that was mentioned earlier in some of the staff introductions, that we've also had staff openings. So we've had this really weird dynamic where you would think that would be higher, but we've had staff that have either moved on. So we've got these vacancies kind of tempering that number just a little bit. So we're only at 13% higher than where we should be. But when you look at operating, and this is weird, this is just coincidental, it is exactly 13% the other direction in operating. So the prime explanation that I think we can tie to that is that when we looked at really kind of directing staff to work in COVID, initially in our early response and even early this fiscal year, we had a whole host of our staff, the district staff, that were really focused on COVID, and they weren't working in their programs. So if you're not working in your program, they're really the COVID response is unless there are specific needs for COVID, the programmatic operating isn't there. So that's really kind of the nature of the decrease there. And then if you look at capital outlay, it's definitely behind. I did have some chats with some of our division administrators and just kind of reminding them that we have this money sitting out here in capital outlay. You had some plans. There isn't a reason at this point not to follow those plans according to the budget. So that may tick itself up as we start to work through that. So that gives us an overall expenditure percentage of 51.1. So overall across those categories, we're still pretty on track as it associates to our budget, which again feels really weird because we've had a lot of expenditures for COVID, but we've had a lot of decrease when, like I said, we had vacancies in personnel, and then we had a reduction in operating based on costs that weren't expended due to people not working in the program. So that's kind of it in a nutshell on this page. Did anybody have any thoughts or questions at this point that I can address? Okay, well, hearing none, I'll move on. So the next page is really just kind of a...
Hey, Troy, wait a minute.
Wait, hold on.
Commissioner Aberstary had a question.
Okay.
Sorry,
Sorry.
I was not mute. I mean, my thing said it was green. So, hey.
Yeah, no, I can hear you now.
My question is on the personnel. We got 63%. I guess, I just want to make sure that a lot of that is, I know it's due to the COVID. Is that going to be funded by the CARES Act, or is that, I know the CARES Act is, I think, done now. Or if we just carry on and fund it ourselves from this point forward. I need to know that, because as a board, we need to know if we're going to have the funds available to continue going down the road we're going, because we're almost 65% of our budget on personnel, and we got half the year to go. So need to know those answers.
No, Commissioner, thank you. That's a really great question. Thank you for asking it. I think you're right on target, really being with this kind of relationship with how we're approaching the budget and how that's going to end. You know, in the conversation I had with Nikki and the group yesterday was we're still kind of in this a little bit of a wait and see environment, and so I'll talk a little bit about that in my later presentation, but we're kind of in that wait and see. To answer your question, how it's funded, so you are right on target. We have the bulk of our reimbursements, like I mentioned earlier, come from DHW grants. So these are sub-grants specifically targeted for COVID response, and they primarily come out of the preparedness and EPI grants. So these are grants that have been retooled to kind of encompass all of our COVID activities. However, you're right on, the CARES Act did end as of December 30th. So we have some reimbursements that are still pending for those. So as of to date, from what I know, we have, I think what I gave CFAC, which is the oversight committee for the CARES funding, the number that I gave them that we would attempt to get reimbursed for, and this is personnel and operating, is about 500,000. So we have about 500,000, and that is a period in July where we had a gap in sub-grants. Then I've got a period in October, and then the CFAC direct is November and December. So there's about $500,000 that lives in there that's not been reimbursed. So yes, you are correct. But if all goes well, based on my connections with the other districts and with the CFAC committee itself, conversations back with Dave Fulkerson and Sarah Stover, they're pretty confident that we should get reimbursed for a good chunk of that. So then the remaining amount that doesn't get reimbursed out of there is going to then need to be turned to FEMA. And as we all know about FEMA, and that is a really, really slow process. So there's a chance that whatever doesn't get reimbursed through the CFAC funding will live in the district and will rely on district funds until we can seek reimbursement from FEMA. But our intent is that it's all reimbursed at this point. Did that help?
Things on? Okay, there it goes. My question is, if we get part of that 500,000, or a fair chunk of that 500,000, is that enough in personnel to get us through to the end of our fiscal year? If it's not, then we need to know that now as a board, so we can look at what we need to do to change things. Because we'll have to take resources from somewhere else to cover those costs, because we still have to do the COVID, we still have to do all the other business that we have. So I need to know if that money will cover those costs or if it won't.
Yes, thank you, Commissioner. I think you're right on target. I'm really glad you're asking these questions. These are kind of the questions that I think in the long run will be those things that kind of put us in those spaces of can we do this or not? And so to answer your question as succinctly as possible is I believe so, yes. I am extremely confident that we will get reimbursed enough that there won't be any significant drain on district dollars to the point that we need to seek another funding pot. You know what I mean? Like, as an example, well, we don't have funds here to cover this, so we're going to have to pull it out of savings, that kind of environment. I don't see that at this point. It's still a little early. We'll know probably more as we get closer to the end of third quarter. I think third quarter will give us kind of that's when we need to make this decision. Are we going to be at the point where we need to start dipping into savings? And at this point, we've not really had to do that other than dipping in long enough just to get reimbursed, and then it goes back into the pot. So And you can actually see that play out if you look at the fund balances at the top in the upper left. If you look at our fund balance as of June 30th, we're just over a little over 4 million. We're currently in our fund balance at almost $4.4 million. So you can see that we've not had to drain those significantly. Now, yes, we may have been further along had we not had to wait for these reimbursements, but we are at this point not dipping into that pot so deeply that I don't think that we will have to find another source. So short answer, I don't anticipate us not getting reimbursed enough that we won't have the resources to fulfill what we need to do.
Thank you, Troy. That's the end of my questions.
Okay. Anyone else? Well, and the remaining graphs are just kind of graphical representation of what you see on the first page, just to kind of give you a little bit of a trend. For those folks that haven't seen this before, when you're looking at October on your expenditures graph, that is a 3 pay period month, so that's why personnel is significantly higher that month. And then you can see our revenue trends and then our expenditure trends. The last graph is really about our investment yield. This is the one I was talking about. So if you look at the beginning of the fiscal year, we started at 0.8586 essentially %, and we're currently half that. And so you can see that as the interest rates drop, so do our yields. And so those yields are specific to the investments that we have in those LGIP accounts. And so those are, and you can see based on the graph that they tie, the rate ties very closely to the yield. So there's not really an issue of, so the reason I created this graph was to provide you, so like as an example, if the rate kind of went down but the bottom fell out of our yield, that means money has essentially been moved out of those funds and elsewhere. If we can keep those yields close to that line graph, then that means the money has stayed static essentially, and it's just the yield itself has gone down, creating a lower amount of money that we generate out of those investments. So that's the nature of that table. Alrighty, well, I think that was the end so far of my presentation on the budget and kind of the finger on the pulse of finances. Again, kind of mentioned before, our goal is to get our CFAC funding billed, those reimbursements billed within the next few weeks. Now that cycle is done, we should know, hopefully. They did give us a couple weeks. They'd say, oh, we'll know something in a couple weeks. However, that has not panned out. All of the health districts have really struggled with getting reimbursements out of the CFAC funding, and it's taking months. So with our reimbursement request happening essentially within a couple weeks, it could be May before we know how much of that will be reimbursed. So that is, and at this point, staff are now turning back to those subgrants, the DHW subgrants specific to their working COVID. So that is the end of this presentation. Did anyone have any questions?
Okay. Next thing on our agenda is a budget adjustment request. I guess that's back to you again, Troy.
It is, yes, thank you. And I'll try to, I might be a little over, so I'll try to make this brief. So when we talked about earlier, when we looked at these budget numbers, our initial intent for the budget adjustment was to look at the budget itself and say, okay, well, based on what we anticipate we'll spend and some of the new funding sources that we are getting, we may need more budget authority. But I chatted a little bit with the leadership yesterday with regards to how to go forward with this based on, and essentially it's just, it's an equation of, how do I explain it? It's a delivery equation. As an example, you can just dump all the money you want in the district, but if I've only got this many resources to do it, I'm only going to spend this much money, even if you've given me $1 billion. if I've only got this many staff and this much going on, I can only get so much done. So we talked a little bit about what we anticipate our spending to be through this fiscal year based on some of those changes. Now, based a little bit on the conversations we've had about personnel, there may come a point as we get further into the fiscal year that I may need to request some personnel authority. As we get further down the road, like you can see, we're currently 13% over. I may exceed, in fact, I'm pretty confident we're going to exceed based on our pattern, but I'm not 100% sure that I know exactly what that'll be. So I'm a little hesitant at this point to ask for that. So really what I'd like to do today, if you guys are open to it, is I would like to present to you the different, because I know we had talked about several months ago, keeping you in the loop of what funding opportunities we've had before us and what funding sources we are using to kind of either fund our COVID response or fund the other activities that are happening in the district. So I'd like to share my screen. And I don't know, Ashley, if I'm set to do that. So you tell me if I do this wrong. Let's see if I do this one. And go there. Can you see my screen?
Yes, it looks great, Troy.
So what you see before you is essentially the new grant activities that these are funding opportunities that we've had this fiscal year or things that have changed since we initially created the budget in March and April of last year. So I'll just go down this list. I don't know all the specific details, but what I do want to just let everyone know is these are a good chunk of these, almost all of them, are subgrants that come directly from, I think nearly all of them are from health and welfare. We have, there might be one that's not, but these are grants for additional activities. You get to see the COVID activities. So in the top, we have an immunization grant that increased funding of $12,200. We have state immunization grant that they've given a $12,877. Again, these are activities that the district has already been doing, but because of everything that's going on, the grant was increased by those amounts. So when we look at the oral health HRSA grant, this is for silver diamine fluoride. This is a new grant of $22,981. So this is work that's being done. We have a COVID vaccine grant. This is $65,379, and there's some work on some additional funds there. We have a seasonal influenza grant that's new for $18,991. We had an oral health sealants grant, which is an increase of $11,674. The WIC grant received an increase of $15,035. The school health grant, so this is a grant that's new for school health care. So this is work out in the schools themselves for $12,967. So this is on the clinic side. And then we have our ELC cares. So this is enhanced funding for COVID. That is that. So initially we had talked, I think a few times ago about a $4.7 million grant. That's this grant. It's currently at 3.2. We have the PHP. So this is preparedness COVID grant. So that was $360,753. We have a school health COVID grant of $477,500. We received a Kresge Foundation COVID grant of $35,000. We had an increase in our NEDS grant. So this is activities that were currently happening that we've had for some time and increased, I think, primarily to kind of add some COVID activities to, for $23,381. Similar for the tuberculosis grant of $13,654. We had a suicide prevention grant of $30,000 and a new grant from DHW that we just got today of $50,000 for the Regional Behavioral Health Board. So these are new funding opportunities that have come about as a result of changing activities that have happened that we weren't aware of as of the beginning of the budget that we created in April, in March and April of last year. So this is where this gets a little wonky, and I wanted to make sure that I kind of walked through this. So as an example, when we talked earlier about you can throw all this money at us, but we have limited resources to get them done. based on what I can see and what we can see in our trends, there may come a point later in the year where we'll know, based on these new funding sources, unless we hire new people, we're going to stay on target with what we're currently spending, and we may not actually need additional spending authority. Again, like I mentioned earlier, my hunch is that as time goes on, we're going to know more about our personnel authority level, and we'll know whether or not, I'm very certain there's going to come a point where I'm going to need to say, hey, we're getting really close to our spending authority and personnel. We may need to increase it this much, and then we'll provide a presentation and request approval from the board. At this point, I'm a little uncomfortable asking for spending authority on all of these grants. As you can tell, it's a good chunk of money, because this is twofold. So a good chunk of these grants, they don't live, like as an example, not all of these end on 6/30 of 2021. Nearly all of them expend multiple. So like as an example, this ELC CARES grant goes into calendar year 22, which is going to be fiscal year 23. So there are, some of these funding sources are very long, and there is an environment that they'll have to be built into our fiscal year 22 and potentially a fiscal year 23 budgets. And so I'm uncomfortable to come before the board and say, hey, can you give me authority to spend all this money, when in reality, that's probably not what's going to happen. What's going to happen if we stay on pace is we're going to stay really close. And so I wanted my presentation to you today, and my request today is to kind of stay on track until we know more about what this is going to look like, and we may know more by April or May, and need to make that request to increase our spending authority. But I did want you to see what the different funding opportunities that will be for us. Again, these are not on the fiscal year, so we can't equate them directly to what we'll need. But I wanted you to be aware of this information as regards to how it might impact what we do going forward. I think that's it, unless there was any questions. I know this is an action item. I'm not certain what that action item would look like, so I'll let you guys work through that piece, but just tell me what you need.
Yes, go ahead.
Are there any match requirements on any of the grants?
Yes, Commissioner, that is a great question. We do have a match requirement on, it is the silver diamine fluoride, it's the HRSA grant. That 22,981 does come with a match requirement. What I believe the program has in the grant negotiations, they had decided to use, opted for I've gotten this correctly, we opted for the 10% de minimis indirect rate, and then we'll be using that indirect rate as our match on that grant. The rest of them, I'm not aware of any match requirements on the rest of them.
Thank you.
Any other comments or questions?
Yeah, I just wondered.
I mean, there's a lot. I'm sure there was a lot of information there. Go ahead, Vicki.
I just wonder, can we get a little bit more of a breakdown, or just I mean, you don't have to speak about it anymore, but can we get a sheet that says where all those grants are actually coming from, or the ones that aren't listed from a foundation, are they all state, federal? I mean, you don't have to talk about it now, but could you provide that to us?
Yes, yeah, Commissioner, that's a great call. What I'll do is I'll reach out to programs and have them write kind of a brief synopsis of the activities that are built into those grants, and I'll definitely check with leadership to make sure that I have all the information that we need. But yes, I'm very happy to provide that information. I think it would be a great opportunity for you to see kind of the activities that are associated with those funding sources and things that would be required staff to get done. So within those timeframes, and I'll also have them add in the actual grant cycle so you can see which fiscal years it's crossing into. I'll make it something.
Troy, this is Commissioner Elliott. I'm probably too far back, old school or whatever, but when I look at grants and when I've seen grants come through our county, I mean, not only is there, cost share or whatever, but my main concern or question, not, I guess it's a concern too, is so what if you get a grant for $300,000 if you have to provide a certain activity? Does the grant pay for itself? I mean, what is the purpose of getting a grant if it's just a break even unless it also furthers the services that the district should be providing? I've seen that too many times, that a grant just is a grant just to have a grant, but it doesn't do anything. And so I would like to see those questions answered too before we just jump on every grant that comes down the road and say, well, we got more money, but what does it really cost us?
Well, I think I can safely speak to half of that question. I apologize, Commissioner, for not being able to kind of fill in all the blanks. I think this description that Commissioner Purdy requested, I think that will kind of answer some of those questions. But I think I can speak to the other half of that question. So does it cost the district any additional funding? There are grants. You are absolutely correct. We do have some grants that actually cost the district. We expend more money than what we get in these grants. But those are few and far between. I can't speak to kind of the nature of how the programs look at how that goes, but I think as a rule, we really try to stay this kind of neutral environment. Obviously, as a quasi-state or a government, a local government entity, our goal is to kind of stay cash neutral. We're getting money in, we're doing this service, and that's it. We're not here to make a profit. However, I get your point with specifics to, are we just taking grants is it really adding, are we getting any return on our investment? Is it adding to the benefit of the district? I think that's going to be outside of probably what I can speak to, but I'm hoping that some of the information that the programs provide you will give you a little bit more detail as to some of the benefits, some of the services that are being provided, and how does that really provide this kind of larger return on investment for the district. And Nikki can probably speak to all of those as well. So like I said, I'm happy to help, but that might be a little out of my wheelhouse.
Okay, thank you.
Yeah.
Anything else? If not, thank you, Troy, for that. And I guess we don't need an action item on that for this time around. So we're a little way behind schedule now. But let's go ahead and take a 5-minute break, and we'll come back and get started again.
Great. So it sounds like we will resume again in about 5 minutes here.
4.5 or 7, I don't remember. But I think it's enough. Okay, everybody, looks like we're back, so let's get going again. Okay. What do we got on the screen? What does that say up there? I can't read that far. Okay. Can we just get started then, or do we need some more, or are we waiting for our administrator type person? Okay. Then we will start off now with an action item for approval of fee schedule changes. And Carol.
Can you hear me?
Yes, ma'am.
Okay. I do have 2 fee approvals that are needed, and then Emily mentioned to me that Commissioner Abasteri had some questions on WIC numbers, and she said she could provide that today or next meeting. So, what would you prefer?
Can you hear me?
Yep.
Can you hear me now? Okay.
Yes, I can.
Next meeting would be fine.
Okay, we'll plan on that. Okay, so the fee approvals are in your board packet, and the first one I'd like to run through is administration fees for the COVID vaccine. And as you look at it, Pfizer has a code that we use, and Moderna has a code. So there are 2 separate codes on that, and there's a first dose fee and a second dose fee for each of them. And this is administration fee. So I don't know if you have any questions on that before we get that approved.
For administration fees?
I didn't hear all of your question.
Say this is an administration fee?
That's correct. The vaccine is
What do you mean on that?
the vaccine.
What we're paying for?
Say that again.
Is that what we're paying for, or what we're?
No, to pay for administration of the vaccine. Vaccine comes to us at no cost.
Give to each vaccine to the citizens.
Correct.
Okay, thank you.
Carol, this is
Yes.
Commissioner Elliott.
Yes.
The difference in between the 20 and the 35, what's the difference on the administration?
I asked that question to myself too, so I researched it a little bit. One of the explanations that they provided, and we go off of Medicare, how they process their vaccine cost. So we go directly with CMS. But they talked about that the rates recognize that the costs involved include the additional resources involved in conducting outreach for the second vaccine. So after you give the first one, then you do some outreach reminders to get people back in. So that helps a little bit with that. That's why the cost is a little bit higher for second dose. First, there is going to be a 1 dose vaccine coming out pretty soon. It'll just be 1 fee. But right now, these are the 2 that we have available.
Okay. No, I think that answered it very well. I understand that.
So do you want to approve this one first and then the next one second, or how do you, or finish looking at them?
Okay.
Yes,
go ahead.
Okay. Commissioner Abasteri asked who these get charged to, so it'd be the private or public health insurance provider.
Correct.
So anybody who doesn't have the ability to pay, who isn't covered by insurance, we have contract funds that would cover the administration cost.
Okay. Very good. Yes, or are you're asking for more, or?
individuals who don't have the ability to pay.
Okay. Any other questions on that for Carol? Comments? If not, we need to have a, yes, go ahead.
Two fees. I don't know if you want to have one motion to accept both fees or if you want to do those separate, but there's one more fee that needs to be approved.
Yes, go ahead. Yeah, I think so also. That gives a better chance for if somebody has questions or reservations to be able to do that. So I would like to do them separately if possible. So on this, for these fees of the $20 and $35 on the second dose, 20 on the first, 35 on the second, which would apply to both the Pfizer and the Moderna at the present time, I would stand for a motion. Okay, I have a motion. Do I have a second? Okay, I have a motion and a second. Kelly?
I seconded that. Thank you.
Okay, well, it's that time of day. With that, then, I have a motion and a second. All in favor of accepting those, I guess, dollar amounts? I guess say aye.
Aye.
All in favor, say aye. Aye. All opposed? Okay, hearing no opposing, I'm guessing it is unanimous. Okay, on to the second one then, Carol.
Okay, the second one, you guys can hear me okay?
Yes.
Is for home visiting programs, nurse-family partnership, and parents as teachers. And this was put into place legislative action on this one to assure some sustainability of these home visiting programs. So Medicaid is providing reimbursement for encounters, is what they call them, or a visit to a family home, and through these programs and their curriculum. So it is been calculated out, and this is a statewide figure that they have utilized the $250.12 per encounter. So that's one visit.
Okay. So, so Medicaid would be paying that to the district. Is that
correct? That's correct.
Okay. And so that needs to be our rate of charge. Is that, am I understanding correct?
Yes, that's right.
So is this a fee, or how do we have, what's the designation for this?
Call it an encounter rate.
Encounter rate, okay.
Encounter rate.
All right. Does anyone have any comments or questions for Carol on that? Yes.
Question. A question from Commissioner Eversray. This is because it's in the form of a fee. Is this our actual cost?
It was, Nikki, you may have more information on it, but I believe it was calculated out through a statewide task force that took a look at all the health districts and their expenses and the time they spent with the families, and they came up with this. So I don't know if that
Elliott
answers you.
Yeah,
I'd just like to expand on Carol's question. So the funding, so the work that is done under the home visiting, some of that's paid through federal grants that are subgranted to us in nurse-family partnership. The other is parents as teachers, which was appropriated by the legislature for the last few years in 100%. And the public health districts worked with the legislature to advocate for allowing for Medicaid reimbursement to take some relief off state appropriation funding. directly for this program. And so Medicaid, so this all started last legislative session. Medicaid had worked on an approval rate for approval after the legislature basically got like an amendment to allow Medicaid to add this as a billable service. So it allows us to help recover some of our costs, but potentially expand the service into more of our rural areas as well. It does not cover our cost. I don't know that Medicaid ever will cover the cost, but it helps offset the cost.
Well, that's the main thing. Is a fee cannot make money.
Correct.
On a fee, cannot. So as long as it's not making money and it's still costing, it's okay.
Yeah, and I'll also just add that these programs are really targeted towards underserved individuals who are Medicaid eligible, so we wouldn't have an environment where we'd be billing private insurance.
Very good. Any other questions or comments?
This is Carol. I just had a couple more things to add too. There is a screening process that's conducted prior to qualifying the family. And then there's also rigorous paperwork taken care of to make sure of how the visit is billed versus the funding from the other subgrant to make sure it's all in line.
Right. Okay. Okay, is there anything else then? If not, then I would stand for a motion for the encounter rate to be $250.12. Okay, have a motion and a second. All in favor? Commissioner Abasturi?
Commissioner Abasturi made the motion.
And Dr. Summers seconded. Okay. So I have, again, I have a motion and a second. All in favor say aye. Aye.
Aye.
Opposed? Hearing none, motion carries. Okay, very good. Thank you, Carol.
You're welcome.
On to the audit report from the Zweigert and Associates.
Can you hear me?
Yes, sir.
All right. I am going to share my screen. So I'm Jordan Zweigert from Zweigert John Associates. We did the audit for the fiscal years 2018 and 2019 this year. So I'm briefly going to go over the audit report. I'll just kind of hit some high points. So if you have questions or want me to jump into more detail, please let me know.
Okay.
So let me see. I was going to try to share my screen, but it looks like that is turned off there. So if you have the audit report or a PDF in front of you, right up front there's a summary that kind of goes over the audit, goes over our findings. So first off, there were no major issues that we saw. The financial statements were put together, were materially correct. We didn't have any changes to those. Everything looked to be tracked correctly and written down correctly. In going over things, there was one recommendation that we had made to management, and that was just on some of the cost allocations. They were being done based on the original budget for that period. We recommended that that be changed to use actual costs, just so that the funds are allocated a little bit more to what actually happened versus what was anticipated at the beginning of the year. In the prior audit, there were some findings that we did review. The first one was the non-cash expenditures on the schedule of federal awards was understated. We reviewed that, didn't have any issues with that this year, and saw where controls had been put in place that's now double checked, so that should prevent that error from happening going forward. The next one was the indirect cost rate contained some errors in the calculations. And Troy, yeah, if you could share your screen, that would be great. So I'm on page 2 of the PDF. So our second finding, that second finding there for the indirect cost rate, we looked at the calculations for 2018 and 2019, and everything looked to be calculated correctly. We did not have any issues there, and so that was closed. We didn't have any more findings on that. Continuing to the next page, at this 2017-2002 finding, there was some new personnel in the prior audit, and that caused some documentation for some programs not being able to be located. We went over the reports for fiscals 2018 and 19. We saw where the reports were being done. We saw where those reports were being reviewed. So again, we closed that and reported no issues there because that had been corrected. I'll jump down to 2017-204. There were some direct costs. The documentation was not available. Again, in reviewing things this year, everything we wanted to see was made available to us. There was no documentation that was missing, and there was support for all the direct costs being allocated. So all those findings that were there last year, we reviewed them and we found that they had been corrected, and controls have been in place to prevent those errors from happening in the future. Any questions on those prior findings or our recommendations for this year? All right, from there, I'm going to jump forward to page 5 of the PDF. I already touched on this, but this is just the auditor's report. What it says, first and foremost, is these are your financials. Everything after this came from Troy. We looked at the supporting documents and how things were pulled together. In our opinion, everything was fairly stated on those financials. So what that really means for you as a board is through the year, as you're looking at reports, you can rely on those. Those are accurately showing what is going on. From there, Troy, if we can jump down to page 10 of the PDF. Because these numbers are back from June 2018, 2019, I'm going to skip over the balance sheet because that's kind of out of date, but this is the result of operations for those 2 years. So you can see for fiscal year 2018, 9.2 million was brought in, 8.8 was spent, increasing the reserve by $412,000. And then 2019, 9.6 million was brought in, and 8.8 was your total cash disbursements, increasing that cash balance by $770,000 for that year. So both of those years, you were able to increase the cash reserve you had on hand there. Any questions on that? From there, I'm going to jump forward to page 13. Most of these footnotes are pretty, just go over the accounting policies and you have, and to a little bit more detail, very similar to what they've been in the past. Here on this page just shows part of your net position, part of that cash balance is restricted by certain grants. And so this right here at the top just breaks out where those funds are restricted. So you can see most of the restricted funds are for the parents as teachers. There and in 2019, the Behavioral Health Board had some restricted, but no other restrictions were there. Going down from there again, this is just explaining kind of a lot of the definitions on the financial statements as far as how things are constructed. All of your cash balance, because cash we saw the restricted, you have some of it that has been committed, set aside for future projects, and then some of it that is assigned for specific things. So you don't have any unassigned fund balance. All of your fund balances have been, they're either restricted by a third party or they've been committed and assigned to a specific project. So it's not just that you have funds there, all of those funds have been allocated to a future project. From going down there, again, these just break out into more detail, those restricted funds and the policies of how things are assigned. And you can see there at the bottom that there are no unassigned funds for either year that was under audit. And then here, this order of spending, this just shows that you're going to spend, your policy is spend restricted funds and then committed funds, and then once those are done, the assigned funds are spent. So it's just the order that those funds are used. Footnote 3 here, this just talks about where your funds are held. Any excess funds are held in the local government investment pool, the LGIP. So if you scroll down a little bit more, I think to the middle of the next page, you can see at the end of the year, the local investment pool, 2018, you had 3.4 million sitting there. And then in 2019, you had the 4.4 million sitting in the local investment pool. Again, those funds, they're sitting there till they're used, but again, they have been committed or assigned to specific things going forward. Footnote 4 just describes that the entity, you're part of Percy, and part of that cost sharing plan. As you go down a little bit more, this just explains Percy, how the benefits are calculated. And then down at the bottom of that footnote, right here at the end of this paragraph here, you can see the amount that was contributed during the year. For 2018, it was the 487,000, and then 2019 was 495,000. Footnote 5, post-employment benefits other than pension. There are, with with health insurance and people staying on there, as the counties, you've probably seen this other post-employment benefit on some of your financials. Because the district's on a cash basis, that doesn't show up on the financials, but this just describes that there are some of those other post-employment benefits that are there, but again, not showing up on the financials. Scrolling down to footnote 6, leases. So you did, the big lease here was that capital lease on the building. That was paid off during the period under audit. So in July, so the ending balance for fiscal year 2018 was 0, as that was paid in full during that period. So you no longer have that lease as of 2018. And then going down to footnote 7, this just says that you carry insurance to mitigate risks, as all entities do. So nothing there. The insurance you carried was sufficient to be able to match that risk. From there, the next ones we'll look at briefly are the supplementary information. This is what was budgeted versus what actually happened for the year. So you can see here for the year ended June 30th, 2018, your budget was at $9.3 million to bring in anticipated. You brought in the 9.2, or about $115,000 less than was originally anticipated there. And then if we scroll down, we can see on the disbursement side, you budgeted to spend that full $9.3 million. You ended up spending only $8.8 million, or about $527,000 less than was budgeted there. You can see most of that underage comes from personnel costs coming in under budget. Jumping to the next page, this is the same thing for fiscal 2019. In 2019, you budgeted to bring in $8.9 million. You were actually able to bring in 9.6, or about $740,000 more than was anticipated. As you can see there, the big driver of that was contracts coming in almost $850,000 above what was planned. Then on the expenditure side, you planned to spend the 8.9. You spent 8.8, only about $26,000 less. So really close to what was budgeted. Again, personnel costs came in under, but operating costs kind of offset that as those came in over what was anticipated for the year. Any questions on those budget versus actual reports? All right. From there, I'll kind of just touch base on these other items that are through here. This just is a footnote explaining the budget process and how that's approved. Scrolling down here. So this report, this is your schedule of expenditures of federal awards. So this just breaks out what grants, your federal grants were spent during the year. As normal, the largest portion of that is the WIC funds, are a big driver of the federal awards that are spent for the year. So it's, you know, as you have quite a few grants here, this is 3 to 4 pages long, explaining all of those grants. But that kind of just breaks out by the granting agency, who provided it to you, and the amount that was spent in those fiscal years. So if there's not any questions on those, I'll kind of just skip through those there, unless someone had questions on where those were coming from. Going. I think one more page is the end of that. So then these notes here, this just explains how those funds are come to. The big ones there, footnote 2, note 2 there on that. This just explains a lot of the WIC funds you get are not actual cash. A lot of that's the value of the food vouchers. So you can see in 2018, that was 4.1 million. And in fiscal 19, that was 3.7 million. So a lot of those funds thrown through that CFA aren't actually cash you got, but are the value of those vouchers that you pass through. And similar, note 2, the vaccines, that 258 for 18 and 246 for 19, the value of those vaccines, and that's not cash you got, but it shows up there because that's the value of what was passed through. Going on from there, so because of the amount of federal funds you receive, we put 2 additional reports on the audit. This first one is that says the audit is conducted in government auditing standards. And what that means is, in addition to just looking at the finances, we also look at internal controls over the financial reporting and compliance. In our review of internal controls, we didn't see any issues to report. As we looked at invoices and bank statements, we saw evidence of multiple sets of eyes reviewing items. And so we saw good checks in place to make sure that things were being approved properly and that only the items that should be were being paid. And again, we saw that also on the bank statements, that those were being reconciled and looked at. And then on the compliance side, we did not have any issues to report on compliance. Everything was in order and everything was being done in accordance with the agreements. Going to the next page, this report is specific to the federal funds. Again, specific to those we test, the controls over how those funds are spent, the controls over remaining in compliance with those agreements. And we, in reviewing that, we did not see any significant or material deficiencies. We saw where multiple sets of eyes were reviewing applications, were reviewing the reports. We saw where there was good controls in place to make sure that those were being done. And that on the compliance side, we saw evidence that those were being done and that all the policies were being followed. So we did not have any items to report there. After that, going down, so yeah, this is just that report saying that we didn't have any internal control deficiencies to report on those federal funds that were being spent. This is just a summary report here, simply stating that no issues were reported there. If you keep going down, this just shows you the major programs. These were the grant programs that were audited. So we audited the WIC and the Immunization Cooperative Agreement. WIC, because of the dollar amounts, audited pretty much every year. And then we try to rotate through some of the smaller grants just to make sure that those are being looked at on a periodic basis. I'm scrolling down. And again, no matters were reported there. to be reported during the year. The next page here, this is simply, I mean, we kind of touched on these already, but these were the prior year findings, and this is, Troy wrote up a brief report on what they were and what was done to correct those issues. Again, we looked at those, we looked at the corrections to make sure that they were implemented, and we saw that they were, and that the errors had been corrected, and no issues were happened in those during the year. After that is an appendix, just a brief history about the district, and then after that history there is just a brief definition of the organization, what the district does, a good just synopsis of the health district and what it does and how it's organized to provide those services. Let's see here. Staffing, funding, just discusses, where the funds come from. And then the last page here is just a very high level organizational chart of the district. So there was a lot there, and I kind of just hit some high points there. Any questions on the audit report or anything regarding the audit?
Anything, commissioners? Okay, sounds like not.
So then you'll just want to make a motion to accept the audit report for this year, and we'll be good for another year.
It's not an action item, but I want to thank you, Troy, for your work of getting this back on and being in compliance with our auditors. Thank you.
Okay. We can't, as Nikki said, we cannot make a motion on this. It was not agendized as an action item. We'll have to do that on the next meeting. It is just agendized as an information.
Okay.
Commissioner Purdy, I don't know if it's been sent to you, but we can definitely send it out. Yep. Yes. Sure. Yeah, we can share that out. I'll make note of that. And I maybe just would add, too, that it was very refreshing to have a very timely audit report, not waiting a year and a half after the audit. So thank you to the board for approving us to be able to go with an independent auditor.
Okay, very good. Is there anything else about the audit report? If not, thank you very much. We will then go to Mr. Tom Dale. For,
Good afternoon. Can you hear me?
Yes, sir.
Go ahead, Commissioner. Do you want to say something?
Nope. I think we're just all waiting for you.
Oh, with bated breath, I'm
and
sure.
You've been waiting for us because we're behind schedule.
Yeah. Well, I'm over here in the IAC office here behind the State House, enjoying a conference room all to myself, so it's pretty nice. I just have a quick report on Executive Council affairs that have occurred since we last met. The Executive Council made a decision to meet virtually every Friday, and so every week they have been meeting to discuss matters that are pertinent to the health districts across the state as it relates to the legislature. In order to have some professional help to walk with us through the legislative session this year, which, as you probably are all aware, has some high attention that is being paid to a lot of the issues that are going on with the health districts, and a number of bills and potential bills have been discussed. The Executive Council did hire Mike Kane, who's an attorney here in Boise, for 3 months for the cost of $5,000 per month to be our lobbyist and to represent all the health districts across the state to the legislature. Michael Kane, some of you are familiar with him, but he has been working with health districts for over 20 years, specifically representing Districts 3 and District 4. And then more lately, in the last 10 years or so, he's been the legal representative for District 7 on the eastern side of the state as well. And so he's very familiar with health district matters. This morning, he presented to the the House Health and Welfare Committee an overview of health districts and how they operate and what they do and all that kind of stuff. It was a very good presentation. This afternoon, he will be presenting to the Senate side at 3 o'clock, basically the same presentation, just in an effort to help educate legislators who, for the most part, do not know the full scope of what health districts actually do. Because of COVID this year, health districts have gained a lot of focus and attention, and a lot of that has come. And I just had a conversation over here after the meeting with Brent Crane, and a lot of the discussion that he shared with me has been in relation to what has been going on with District 4 over here in Ada County, particularly. And so anyway, this is an effort to try to educate the legislators on what health boards do. And just to let you know, there are some draft legislative bills that have been are being worked on. Michael Kane is working hand in hand with all of the pertinent legislators on the Senate and the House side, the chairman of those particular committees, to craft some bills and be proactive, to really present some changes and some modifications that would be acceptable and beneficial to the health districts as they seek to perform their duties. One of the bills particularly is about the powers and duties of health boards, particularly their authority to use restrictions, isolation orders, quarantine orders to protect the public health. There's quite a bit of discussion going on about that, and I won't go into detail about that at this point because those are still all in draft form. Once they get published in RS, then they will be available for the public to evaluate. Another important one is about the violations of health district orders. Right now, there's only one way to do that, and that is to call it a misdemeanor. That is not really acceptable to most people, and so there is talk to change that to an infraction rather than a misdemeanor, thereby making it a much less serious offense. The final one that I'll talk about just briefly that is being proposed, a bill that is being proposed dealing with the composition of health district boards. Most district boards have, all district boards have a majority of elected county commissioners serving on those boards. There are a number of boards that have non-elected officials. Almost all the other boards have former county commissioners serving as health district boards. They continued on in that capacity. District 4, again, is garnering some attention because out of their seats they have right now, I think 3 of the seats are occupied by appointees and not commissioners. So that has garnered some attention and will be discussed very deeply in the days ahead, I'm sure. So that's my report. I would stand for any questions if anyone has a question. I don't hear any questions. I just want to make this up.
Just a sec. Had
Okay.
my thing on quiet there.
Oh, okay.
I think Commissioner Purdy has a question for you.
Okay.
I just want you to know we oppose spending taxpayer dollars on lobbyists for the health district. So I'm not really sure what you felt like was so important that we needed to do that. So you can elaborate on it if you want. I think you kind of already have, but yeah.
Well,
My county. My
Commissioner,
county.
okay, I understand that. It was a decision made by the 7 trustees of the health districts. And I failed to mention, but the IADBH, which is the Idaho Association of District Boards of Health Conference Office budget, has sufficient funds to cover those expenses in the bank. So there will not be a charge back to the individual counties and districts for those costs for this year. And Mike is providing excellent guidance and excellent discussions and educational opportunities for the legislators who are given the ability and the obligation to make these kinds of decisions, which will impact all 7 health districts across the state. So it's the health district trustees, executive council felt it was important this year when so much legislative attention is being focused on health districts to have somebody like Mike Kane, who is very excellent spokesman to help us out in particularly this year. It's just for this year. It will be a year by year decision.
Well, in addition to that, you mentioned violations. We aren't legislators as this body, or we do that in our own commissions. So, or the legislators, we don't make law. So, what exactly are you speaking of there?
Okay. Currently, state code allows for violations of health orders only to be charged as a misdemeanor. So that's in the state code. And so the proposal is to change state code to allow a violation of a district health order. And that doesn't just pertain to masks and that kind of stuff, but it's other types of orders as well that may be issued under the authority of the health district to be charged as an infraction, which is a much less level of violation than a misdemeanor, and it doesn't have to go to court, doesn't have to do a lot of stuff there. So that's what the legislators are looking at. Currently, the only ability to charge as a violation is as a misdemeanor, and that's considered to be overkill by most people.
Is there any other comments or questions for Mr. Dale?
Well, Mr. Chairman, I just want to say this may be my last report to you, because I'm anticipating that by the next official board meeting of our district, you will have selected a trustee to fill this position. It has been an incredible privilege for me to work with all of you, and to work particularly with Nikki and her staff there at the health district. It has been the highlight of many of my days, and something that I will value as I move forward into this whole thing they call retirement. I will not be a stranger. I will be available for anything that you may deem that I can be of help. So thank you so much, and I will miss all of you.
Well, thank you very much. I would throw that right back at you. I will miss you, Tom. You've been a good example, and I have learned a lot from you. Just being in association with you the last few years. So thank you very much.
You're welcome.
And yes, the very next thing on our agenda is to replace you. So, yeah, you're probably right. Unless we come to loggerheads, that will be your last report in that position.
And I'll just say, I'm sure you've all met Carrie by now, and she has been selected by the Canyon County Board of Commissioners to fill the seat for the board, and that will have to be ratified by the other counties in the district. But Carrie is very, very well able to fill that seat, and I have a lot of confidence in her, in her abilities, in her judgment. So, just like to say that in Carrie's behalf there too.
Well, very good. Thank you very much. I think she's blushing. I'm not sure.
Yeah, thanks for that, Tom. You have very big shoes to fill, and I feel like I need some time to get my feet wet so that I could at some point fill your shoes. I just don't think that I'm ready for that. But thank you.
Size 12.
Oh gosh, I'm at an 8 right now in men's.
Okay. Is there anything else? If not, we'll say thank you very much, Tom, for your service and your report today.
All right, and I'm gonna leave at this point.
All right, thank you. Okay. Next up is appointment of trustee and executive council representative. I'll turn that time to Nikki.
Yeah. So actually, probably should be your name next to this, but I will just introduce the because it is a little bit I wouldn't say it's complicated, but the Idaho Association District Boards of Health, I think it wasn't last summer because we didn't meet in person, so it must have been the summer before. They reviewed bylaws. So for the board members who are here and may remember, there was a lot of revision to the bylaws to clarify the roles of the trustees and of the executive council members. And the trustee, by statute, their only function is to establish the funding formula of how the single state appropriation is divided among the 7 districts. And then the executive council's role is to probably more policy focused. So like the update that Commissioner Dale just gave is really the role of more of the executive council function, helping making decisions between the annual meeting that occurs with the Idaho Association District Boards. So they help with resolution development, providing testimony to the legislature, advocating on behalf of the public health districts, and addressing issues as they might arise in between the annual meetings. So not a huge time commitment generally, but obviously busier during the legislative session. And according to the bylaws, that the trustee and the executive council representative can be the same person, but do not have to be. And I'll just, because that change happened recently, to my, I believe all other 6 districts have one person that wears both hats, basically. But again, it's not required. So we have it on there as kind of an and/or, depending on what the board would prefer to do. I have it kind of on here on the agenda listed as kind of an and/or if the board wished to appoint 2 different people versus one person to fill both roles.
So it is just an appointment. I mean, how do we do that exactly?
So it's similar. Usually this is voted on when we vote in the chair and vice chair each year as well. So it's just that same process that we've followed in the past, but because obviously Tom Dale's vacating this position now, and with what's happening with the legislature, I think it would be time. I think it's important that we identify somebody on the board to fill that role now so that they can be engaged in what's happening now.
Okay. Well, do I see anybody volunteering? Laundromat? Oh, no. Okay. So I'm guessing you're proposing Georgia for that position.
I don't know that I can do that yet, but without voting on it, I would say that.
Not legally, but, you know.
Yeah. Unless we want to throw the new guy under the bus.
You say absolutely. Kelly agrees. Would you do that? Is that okay?
Sorry.
Georgia.
I don't know you yet. Don't pay me back.
Am I hearing well, okay, if I have to, or yes, please, or absolutely not? Okay. Is there any other discussion or volunteers or any other discussion on that?
If anyone is speaking
That's the way
currently,
it
we cannot
has
hear
been since I-
that through the Zoom.
I didn't hear what she said. Couldn't hear me or couldn't hear who?
She couldn't hear Georgia.
Oh. Okay.
That is correct.
I don't know, you have a little green light.
I think what I said was, I think it's appropriate that one person wear both hats. That it's, there's no reason to have two people sharing the job.
Personally, I think it makes more sense that way, unless you're very close with the other person, so you can share information and a lot of ideas and whatever that's come from one meeting versus the other meeting. I would agree. But,
Mr. Chairman,
yes,
I was involved in why it was done this way. It's in code how this is written, and
right.
So the trustee only does limited. The executive does the rest, and there was meetings going on that things weren't getting done weren't being done correctly by code, and so this was what ended up out of that, was to follow code. So anyway, again, it was always the same person, and it was always meant to be the same person. It's just that one body, it's the same body, just has to, just like we do with Board of Equalization, you have to go out as commissioners and go in as Board of Equalization. Same thing. It's just that it was done incorrectly at the time. That's all. Thank you.
Okay. Thank you. Well, in that case, seeing how this is an action item, I would stand for a motion. Did we already move it?
I think I already moved that.
Okay. Well, you did hear it? Okay. Did we have a second? Second. Dr. Summers, second. So, tentatively, okay. So in that case, I have a motion and a second for Commissioner Georgia to be both parties there. What's the right word? Let me put my glasses on. Be appointed as trustee and executive council representative. All in favor of that motion, say aye. Aye. Opposed? Well, thank you very much. Congratulations. Yes, thank you very much. Okay. Well, I guess I'd have to look up in the bylaws.
I think the bylaws say 1 year.
Is it 1 year?
But it's going to be thrown off now because we usually elect chair and vice chair at the same time. So I don't know if the board would.
Yeah. Okay. Yeah, I'm not finding that. Okay. She's already official. We'll double official a little later then. Okay, with that then, let's go to Nikki for employee compensation as an informational item.
Yep, thank you. A little history, particularly for our newer board members. We had the last budget setting process. The board voted to not provide a pay increase to staff last year. Largely, I think, with uncertainty of the impact of COVID and to the economy. My understanding is that most counties weren't giving pay increases to their staff, and so that's my understanding of the reasoning behind that recommendation from the board, and then it was later ratified by the Budget Committee. And I know the governor had several holdbacks last year. I don't have them committed to memory. So some things have changed, and I just wanted to make the board aware. On October 8th, the governor put out a memo that lifted the budget freeze and allowed for performance, compression, equity, or merit-based pay increases. And then on December 30th, we received a memo from DFM, I think it's Division of Financial Management, and Department, of Financial Management, no, it is Division, and Division of Human Resources, that was a mandate to provide a 2% increase, permanent pay increase to 20 targeted positions in the state. And although we're not a state agency, we, as most of you know, we fall into that same kind of system because that's how our personnel is kind of managed. So they determined that these 20 positions on a survey that they had done statewide were in need of an equity adjustment. Southwest District Health has 7 of those positions, and 21 staff fill those positions. I did not follow the mandate because the board had not approved pay increases, and I also didn't feel that it was the right thing to do for a couple of reasons. One, we tend to bring on staff a little higher than the state's minimum. That's been our policy to recruit and retain staff. So I don't feel like we're as impacted by the equity issues that maybe affect other state agencies across the state. Also, our staff that are still with us have been through a pretty tough year, and a lot of them have worked very hard, and I feel like are very deserving of an increase. And to kind of pick out 21 people randomly at the request of DFM and DHR didn't feel like the right thing to do to me. The governor is recommending, well, DHR, I think I gave you an update last month, was recommending to the governor a 2% change in employee compensation for this coming fiscal year, and the governor has approved that, or is also recommending that in our state budget. As you know, is roughly, I think, 16 to 18% of our overall budget. So, but that's something that usually the board will consider in its decision for budget setting process moving forward. So I just wanted to bring the board up to speed on what's been happening and where we are today with employee compensation as we get ready to prepare for the FY22 personnel budget. That was information.
Did it throw you off that question?
Yes, because I've been wrong before, so I had to think about it.
Is that all you had on that?
Yes, that's all. I just wanted to make the board aware of me not following directions.
Yeah, that was pretty bold. Okay, now it's still to you, those for the director's report.
Thank you. I will try to be quick. I know we're at time here. So I was just mentioning the state budget, so I am not going to go over it in detail. You're welcome to review it at your leisure, but in the director's packet behind the legislative update is the budget that the 7 public health districts have submitted to the state for our state appropriation. And you'll see a name in the top right corner, Tatro. That's Jared Tatro. He's from the Legislative Services Office. He presents our budget to the legislature, well, to JFAC, on our behalf, usually with one of the boards, one of the public health directors, and often a board member to address any questions that come up from JFAC. So just wanted to have that there for you to see should you want to look at it. And second on this list was Rady Camp. So for those of you who've been with us for a while, Rady Camp is a kind of a preparedness camp that we do with our youth in our community. We typically have between, I think, 30 and 40 youth that spend a week with us training on emergency response activities. So they learn everything from how to use a compass and a topographic map to a ham radio, how to put out a fire, do CPR. With everything still going on this year and the demands of our staff time, we have decided to postpone that activity this year and hope to resume next year. So just wanted to make that announcement since it had great participation from youth across our district in the past. And then the last item I just, which I had added to the agenda, was a legislative update. And as I mentioned, that's in the director's report. Not a lot of movement on some of these things yet, just being introduced. And actually, Kelly Brassfield at IAC has put this together for the directors. So if there's any typos, they're not mine. No. As Tom mentioned, there's several pieces of legislation that are being passed around as, regarding the public health districts. One was introduced yesterday by Representative Blanksma, and it's been referred for printing. And so that's a summary on here. And then these other ones are just other health-related and public health-related matters that Kelly had thought were pertinent to share, and I just included them here. So I'm happy to answer any questions that you have. That's the end of my report.
Anyone? Questions or comments? Okay. Nate, are you still with us?
It looks like it. I see his name up there.
Yeah, I see his name. Maybe he's muted.
I'm
Or
still here. I just was. Can you hear me?
Yes, we can.
Okay.
Before we dismiss, I'd just like to personally thank you for your service on the board. I've appreciated your steadiness and wisdom in things that we've been doing, and wish you the best. I don't know if you're retiring or not, like Tom, but anyway,
no, I got 2 more years.
Two
yep,
more,
I got
man.
2 more years. Yeah.
Okay.
So, yep. And
All
I'd
right,
like to thank you and the rest of the board for your patience while I was learning the position, and I wish everybody the best of luck, and I'll be around, and hopefully Lyndon can step in and be a valuable asset as well.
I'm sure he will. I'm sure he will. All right, well, I guess this is your last meeting with us then.